Okay, here is Path and Lab, one of the last sections. After this, we only have one more section of the CPT and then we are done with it. Okay, Pathology and Lab. Again, you've got your table of contents. Starts with your Pathology and Lab, starts actually with lab first. Why they set it upside down, I have no idea. We have several pages here in the beginning. The molecular pathology gene table, I would just ignore them if I were you. Absolutely. Then we have our green, a little bit of guidelines. Then we go right into our laboratory, and these are our panels first. I underline panel, both of these pages, all panels. There's some rules with panels that you'll find here in the guidelines. Pretty much, panels are groupings of tests, lipid panels, obstetric panels, CMP, your metabolic panels. All those different panels come with a collection of predetermined lab tests. And when they're done as a panel, you just code for one code that includes all of that panel. Now, some of the rules are you have to go through and make sure that every single component of that panel got tested. If it's missing even one of them, then you cannot code that as a panel and you'll have to code it all individually. Okay? So that's our rules on panels. Then we're getting into some of our drug testing. They've simplified this a little bit from last year. Last year we had list A and list B. They just don't have that anymore. These definitions and acronyms just used to kind of help you out some. Your presumptive drug classes, you are just, or they are just testing for the presence, not the quantity of it, just the presence of it. So it's a qualitative. Your definitive can be qualitative and quantitative. Definitive is going to tell you how much of something's in the blood. If you go for a drug screen for a job or something, they're going to do that qualitative. They're going to look for opiates and meth and benzos and alcohol and pot and whatever they're looking for. And they're just looking for quality. They don't care how much of it, but if you pop at all or if you're positive at all, then you're not going to get the job if they don't want you to have drugs. I assume if they're drug testing you, they don't want you to be doing the drugs. That would be someone's assumption. They have very much improved their definitions and their examples of how to use these codes. I very much recommend you read the screenwriting on page 501. It is very, very good to explain how to use these codes. These, again, are presumptive, so they're just testing for the presence. Your definitive drug test, that will be testing specifically for that drug and how much of it. Here's some great examples that you can kind of walk yourself through. You do have a definitive drug class listing here, so you can see what the code is, see what the class is, and then see examples of that drug. So this is pretty good if you don't know what drug class amitriptyline is. If you don't know amitriptyline, you find it, and it's the antidepressants. See, it's just easy. Therapeutic drugs, if you're therapeutically taking something, then it is prescribed, the doctor wants you to take it, and probably that drug needs to be in some kind of therapeutic range in order to be effective for you. So these tests are actually testing drugs to make sure that they're at a therapeutic level or staying within a therapeutic level. You're not getting too high because some of them could be toxic like digoxin, or they're not too low to where they're not effective. Evocative and suppression testing, this is they're trying to evoke a response or suppress a response. Your consultations, your clinical pathology consultations, your urinalysis. I underline under urinalysis if it's automated or not and if there's a microscope or not. Then we're into our molecular pathology. And this is another section that is just pages and pages of highly, highly technical Tier 1 and Tier 2 molecular pathology. I would probably paperclip this section together. Chances are it won't be on the board at all because there's only about 1%, 1,000th% of people who use these with any okay, I would paperclip, if I were you, from page 509 to 538. Feel free to go in there and look at it. They're different oncology drugs, just very technical lab tests and pathology on very specific types of treatment. Okay, then we're into our chemistry section. There's 3 or 4 sections here that we're going to talk about. So if you understand the section, then it's a little bit easier to know which section to go to. So your chemistry section is actually checking the levels of different chemicals within your blood, not the actual components of blood, but the different chemicals floating around. This is going to test proteins, sugars, different metals, amino acids, all different stuff that could be floating around in our blood, maybe shouldn't be, but that's what chemistry will be testing. Did I go past? Hold up. No, that's still all chemistry. Okay, then once we get through the alphabet, they're all alphabetized. The next section is hematology. So hematology, it actually tests the different functions of the blood, like clotting, and the makeup, the components that make up the blood. So this is where you're going to find your hemoglobins, your complete blood counts, your white blood cells, different clotting factors. That kind of stuff will be within the hematology, actual study of the blood itself. Chemistry is chemicals within the blood. Hematology is the actual blood. Then we have immunology. This is your antigen versus antibody reactions, your immune system reactions. So do you have antibodies for measles? Do you have antibodies, you know, what's your, I think your T cell counts in here for the HIV folks. Just lots of different antibodies, hepatitis A, hepatitis B, that type of thing. A little bit of tissue typing, very, very, very specific to obviously typing. Transfusion medicine. So this is blood typing in here, not tissue typing. Then one of the last sections of the blood part is your microbiology. Microbiology is going to look for parasites, bacteria, fungus, viruses. That's what they're looking for. So a lot of microbiology, you grow cultures. You're growing cultures out on an auger. They're taking your blood and they're growing it under a light to see at 24 hours, 48 hours, and 72 hours what's growing. This is microbiology. Absolutely one of my favorite sections, other than pathology, because I would love to have been a medical examiner or a coroner. Infectious agent. So that's different stuff. This is where you would grow lots of different things, just about everything. Then we're starting to get into the pathology section. Now remember, this section is pathology and lab, but lab was first. Now we're into pathology. Here are your postmortem exams or your autopsy type of codes. You have cytopathology, which is looking at cells. Cyto means cells, so it isn't tissue, it's cells. Then we get into surgical pathology. With every surgery that is an excision and not a destruction, you will have a pathology report with it. These pathology levels are just like anesthesia. You do not code for them unless that's what you're assigned to code for. You may very well see pathology reports and stuff in your charts. You do not code for them unless they're specifically asking you to code for pathology. Okay, so the different levels. This first level, level 1, is just gross examination, just looking at it with your eyes. That's all it is. Hardly ever happens. 88302, level 2. These different types of examinations are all on assumed normal tissue. And if you look at them, foreskin of a newborn, traumatically amputated finger, fallopian tubes because you don't want to have kids anymore. There was nothing wrong with anything on here, but everything has to go to pathology to be looked at. So this is no disease process. Once we walk through the levels, then I'll explain to you how I use them. Okay, 88304, level 3. These are low risk. And what I mean by low risk, very low risk to the potential of cancer or death. Most likely, when I think of the risk, I think of cancer. When we turn the page, our level 4, 88305, is a medium risk for cancer or death. Medium risk. 88307, level 5, is very, very complex tissue samples, but going into surgery, we did not know they were cancerous. Very likely coming out of surgery, we do know they're cancer now, but going in, we did not know. Your 88309, we knew going into surgery that these were malignant, that these were neoplasms. We knew it going in. So how do I use these levels? And this is one of, in my opinion, one of the most fun places to code from. So you're looking at a op report, and they have taken out a piece of bone. That's just, and so now they've sent a piece of bone to pathology. So what I do is I just start and I try to find my bone. So here, under 88304, bone fragment other than pathologic fracture. Well, I didn't say anything about a pathologic fracture. So they sent a piece of bone in. So this would be the level you would use, 88304. Let's say they took a biopsy of the uterus. Biopsy of the uterus. Again, I just kind of start looking for either biopsy or uterus. They're all alphabetized. So I'm going to see if I have a uterus over here. No, I don't. Go to my next level. Do I have a uterus? I do. With or without tubes or ovaries for prolapse. So this is not necessarily a biopsy of a uterus. It's the uterus because it's prolapsed or fallen out. So I got to keep going because that wasn't right. Uterus with or without tubes other than neoplastic or prolapse. So I was just taking a biopsy of it. So this would be the level 88307. I don't know that it's neoplastic, and it wasn't for a prolapse. Okay, you kind of see, and then here's my uterus that is neoplastic or is malignant. So that's kind of how you just plug it in. I think it's fun. And so you might just want to kind of maybe analyze the different levels, and you'll see these are pretty benign. Then we get a little gunky in here. And then it gets even more involved. And then it just gets more and more complex as the levels go. But it's fun. Okay, a couple of notes we need to put in here. Starting with code 88329, 88329, down to 88334, 88334. These are pathology consultations during surgery. Now, how will we know that they're during surgery? Because the path report will actually say intraoperatively, and then the op report will say, I sent the sample to pathology and I got the sample back, so we're going to take wider margins or blah, blah, blah. So you know that the surgeon was waiting to see what the pathologist had to say before he closed the patient up or not. Now, in addition to these intraoperative during surgery pathology consultation codes, you code also the levels. these levels. Code also. So make you a little note, plus path levels. In vitro type of procedures. Remember way back when I said that I always, if I make a note somewhere else, I always try to make a note opposite so I know which way to go. Way back when we had a lumbar puncture code and I put my cell count by it, here's closing that loop up. This is my cell count and I put my lumbar puncture by it. Reproductive medicine, very specific. And then that is it for Path and Lab. This is really a good section. So now we just have one more chapter left, or one more section left of the CPT, and we've been exposed to all of it.